Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, during a press conference, gave a statement on the tense situation in hospital in the Gaza Strip.
The past 3 days, WHO has not received updates on the number of deaths or injuries in Gaza, which makes it harder for us to evaluate the functioning of the health system. What we know is that only 1/4 of Gaza's hospitals are still functioning. 26 out of 36 hospitals are now closed, either due to damage, attacks, or because they have run out of fuel. Patients, health workers, and ambulances are not able to enter or exit some hospitals. Prior to the conflict, there were around 3,500 hospital beds across Gaza. Today, there are an estimated 1,400, and there are many more patients than beds. Doctors and nurses are having to make impossible decisions on who lives and who dies.
Dr. Richard Peppercorn, representative Occupy Palestinian Territory, said that so far he had informed that 39 premature babies were still alive and that 82 babies have been buried, while 80 remains unburied. Medical staff have to make life and death decisions with patients, he said.
What we have been informed is that 34 premature children are still alive, as per latest reports, and there were 39 to begin with. We were informed that 82 bodies were buried in a mass grave today. Remaining 80 dead bodies remain unburied. We got informed that hemodialysis is done for 45 patients for 2 hours only, that there is no central oxygen, water, power, and fuel.
Tedros Adhanom said that the incursion of the Israeli Defense Forces in the largest hospital in the Gaza Strip, Al-Shifa, is unacceptable. It is unacceptable that the health personnel as well as their available resources must be respected. In addition, added that even if the facilities health are used for military purposes, always apply the principles of distinctions, precaution, and proportionality. Let's listen.
Israel's military incursion into Al-Shifa hospital in Gaza City is totally unacceptable. Hospitals are not battlegrounds. We're extremely worried for the safety of staff and patients. Protecting them is paramount. WHO has lost contact with health workers at Al-Shifa hospital. But one thing is clear. Under international humanitarian law, health facilities, health workers, ambulances, and patients must be safeguarded and protected against all acts of war. Not only that, they must be actively protected during military planning. Even if health facilities are used for military purposes, the principles of distinction, precaution, and proportionality always apply. The safety of patients and staff, as well as the integrity of the healthcare systems in the wider community, are of paramount concern. International humanitarian law must be respected.